This is my presentation from Chapter 4 in the Paula and Beck book, Essentials of Nursing Research. It's Attending to Ethics in Research. Ethics in Research. Ethical issues must be considered in research when it involves humans or animals. There are ethical concerns, particularly that are important in nursing research, just because the distinction between expected nursing practice and data collection can sometimes be unclear. And if you just kind of think of things, look at autonomy, is that being violated? Consent, all of those really play into, the patient. Are they making decisions? Are they able to consent to what's being done? Okay. And this is just some historical background of some of the unethical medical experiments that did go on. And it's not necessarily just in America, but it did happen here as well. We do know about the Nazi program research. It involved using prisoners of war and these quote unquote racial enemies in these medical experiments. And we know the extreme unethical experiments that went on, even in Japan, Unit 731. These studies were unethical because these subjects could not refuse the participation. And they were just outright cruel. The Tuskegee syphilis study, this was conducted in America between 1932 and 1972, where 400 poor African American men were purposely injected with syphilis, and then they withheld treatment just to see the effects of what would happen to someone if they attracted syphilis and they didn't go with treatment. So they ended up having really severely mental decline. And then we have the U.S. federal agencies experiments, and it's been revealed since that in 1993 there was radiation experiments conducted, and it's been going on since the 40s on hundreds of people. And it wasn't until 2010 a U.S. doctor inoculated prisoners in Guatemala with syphilis as well. And that was done in the 40s with the doctor that, inoculated prisoners with syphilis. And there's also other examples of unethical experiments that were done, especially with Henrietta Lacks. And this was between 1920 and 1951, where she was an African American woman whose cancer cells were the source of the HeLa cell line. And it was the first immortalized human cell line, actually, and one of the most important cell lines in medical research. But they did all of this without any of her consent. So what they did was they just took these cells from a biopsy tumor during treatment, and then they just went ahead and used her DNA, and it was without her consent. Thus, the codes of ethics were necessary and developed in response to these human rights violations. The ethical standards known as the Nuremberg Code were developed in 1949 in response to these Nazi atrocities. There were also other international standards that were developed, and this was the Declaration of Helsinki, which was adopted in 1964, and that was by the World Medical Association. In the nursing world, we have our own established code of ethics, and that is from the American Nurse Association, or the ANA, which we covered very heavily in my ethics class. And the most current is 2015, but they are working on a 2025 one. And there's also one that is from Canada as well. But we're going to go ahead and focus on the ANA just briefly. There are 9 provisions for this, and it is a guideline for nurses to follow. Okay? So this ANA has interpretive statements, a document that not only covers ethical issues for practicing nurses, but it also includes principles that apply to the nurse researchers as well. And there are government regulations for protecting study participants. And it's governments throughout the world that fund research and establish these rules to adhere to these ethical principles. In the US, we do have regulations. We have the Belmont Report that issued in 1978, and it's by the National Commission for the Protection of Human Subjects. And this is of the biomedical and behavioral research as well. And again, they issued this report in 1978 from the Belmont Report, and it provided a model for many guidelines that adopted by disciplinary organizations in the United States. Okay. And U.S. ethical regulations codified at Title 45, Part 46 of the Code of Federal Regulations. Not something you need to remember, but just keep in mind the Belmont Report. Ethical dilemmas in conducting research. Researchers who violate ethical principles typically occur because they believe the knowledge gained will be beneficial in the long run. So they're putting the quality of the study above the rights of the participants. And that's in direct conflict. And this is where they're creating ethical dilemmas for researchers. Here are some examples of research problems and ethical dilemmas. And I pulled this straight from page 62. And like the example 1, it's a question that says, does a new medication prolong life in patients with AIDS? So you have the best way to test the effectiveness of an intervention is to administer the intervention to some of them, but then others you would withhold it. So this is an example here. So we're testing new medication in AIDS patients poses a dilemma of potential harm versus benefit. Okay. And then you have a research question, number 2, which is, are nurses equally empathetic in their care of male and female patients in the ICU? So studying empathy in nurses may alter behavior due to awareness of being observed. And then you have 3, which is the research question says, how do parents cope when their children have a terminal illness? Just to answer this question, the researcher may need to probe into the parent's psychological state. And you have to consider that they are really at a very vulnerable time. Yet, knowledge of the parent's coping mechanism might help to design effective ways of addressing parents' grief and stress. So you have to probe into parents' coping with their terminal illness, and that does raise ethical concerns. Number 4 is, what is the process by which adult children adapt to the day-to-day burden of caring for a parent with Alzheimer's disease? And this example is a close relationships in research may lead to disclosure of sensitive information. All these examples, they suggest that researchers are sometimes in a bind. And their goal is to develop high quality evidence for practice, but they must also protect human rights. Another dilemma may arise if nurse researchers face conflict of interest situations, in which their expected behavior as a nurse conflicts with the standard of research, like deviating from a research protocol to assist a patient. And it's precisely because of such dilemmas that codes of ethics are needed to guide research efforts. So the Belmont Report articulated 3 primary ethical principles on which standards of ethical research conduct are based on. And the first one is beneficence. And just always think benefit. Okay, it's in the root of the word itself. So what's benefiting the patient? Researchers must minimize the harm and maximize benefits. The second one is respect for human dignity. And that is the right for the patient to have self-determination and the right to full disclosure. So not only can they be able to fully have the capacity to make their own decisions, They have the right to know all of the information to make a well-informed decision, and we're respecting that human dignity. And then justice, that is the participants' rights to fair treatment and the right to privacy. And that seems pretty self-explanatory. But we're going to explore each one of these, especially with beneficence. It covers multiple aspects. There are aspects of beneficence. And the first one is the right to freedom from harm and discomfort. So, as nurses, we have obligations to our patients to prevent harm. And researchers must prevent or minimize harm in studies with humans. Participants should not face unnecessary risk of harm or discomfort. Harm and discomfort can be physical, emotional, social, or financial. And strategies must be used to minimize all types of harms, even ones that are considered temporary. Now, protecting human beings from physical harm is often straightforward, but there are psychological consequences that are really often harder to discern in research. So there are sensitive questions that may lead participants to reveal deeply personal information. And a lot of qualitative studies required sensitivity due to the in-depth exploration of personal experiences. So those are just some of the challenges in protecting from psychological harm. Another aspect of beneficence is the right to protections from exploitations. So as nurses, we have to prevent this disadvantage. Participants should not be placed at a disadvantage by their involvement in a study. And anything that they do disclose will not be used against them, okay? So we have to provide assurance to them, and there's special care that is required to avoid exploiting relationships like nurse-patient bonds, because they do form these special bonds, and we don't want to violate that whatsoever. Now, managing psychological distance in qualitative research. Psychological distance between researchers and participants decreases as the study goes on, as it progresses. And then there's pseudo-therapeutic relationships that could emerge, and this can lead to risk of exploitation. Qualitative researchers can do good due to close relationship with the participants. However, we just have to be very careful. We avoid doing harm because of those close relationship with them. The second ethical principle in the Belmont Report is the respect for human dignity. And we're going to break that down, and we have the right to self-determination. And what that means is the principle of self-determination allows individuals to decide whether to participate in a study without facing prejudicial treatment. Participants have the right to ask questions. They can refuse to answer questions, and then they can withdraw from the study. And usually any time during the study, they have that opportunity to withdraw from it. The respect for human dignity in regards to the right to self-determination, there should be freedom from coercion. And coercion involves threats or penalty for not participating, or actually giving excessive rewards for agreeing to participate. And there is careful consideration that's required when researchers hold authority or influence over participants, such as in a nurse-patient relationship. And here off to the right, I have some examples of coercion, and they could be very subtle forms of it. And they can offer generous monetary incentives. And I have this on the bottom, and they call that stipends, which encourages the participation, especially if you think about a low-income group like the homeless. Okay? And these incentives may pressure individuals to cooperate, and that can really raise ethical concerns. Another aspect of the principle of human dignity is having that right to full disclosure. And the importance of full disclosure in research is that these participants have to fully be able to know what the study is. So the researchers have to describe it to them. And the patient has the right to refuse participation based on that. And they have to know all the potential risk and all the benefits to the participants. Now, challenges of full disclosure, this can lead to biases and sample recruitment issues, especially in sensitive studies like substance abuse among high school students. That's a good example because they really aren't going to be too forthcoming with that. There are some ethical concerns in research methods when it comes to full disclosure, and you have covert data collection. So researchers collect data without participants' knowledge or consent to avoid altering natural behavior. Now, the deception in research involves withholding or providing false information to participants that impacts their ability to make informed decisions. And the ethical debate on deception, some may argue that deception is never justified, while others believe minimal deceptive practices may be acceptable if the study offers societal benefits with minimal risk. In this day and age, there's another ethical consideration, and that is the online data collection. And data collection from the internet is a debate that arises on using online content as data without the author's consent, and with some researchers viewing electronic posts as a public domain. Protecting participants' rights online are ethical standards in cyberspace research that should prioritize safeguarding the rights of individuals in virtual communities similar to traditional research settings. So some considerations are like those online blogs or those social media sites. I can think of like Reddit, but a lot of those are really anonymous in Reddit, but some of the blogs where they do provide names. So there are some issues that arise from that and some considerations in that right to full disclosure and respecting human dignity. The third principle from the Belmont paper concerns justice, and this includes the participant rights for fair treatment and then the right to privacy. So with the right to fair treatment, there should be an equitable distribution and justice. And the selection of participants, the research participants should be based on research requirements and not on discriminatory factors. And there should be equitable distribution of benefits and burdens of research, which is a key aspect of justice. Another aspect of justice is the right to fair treatment. When you have the inclusion of certain groups that are considered vulnerable, like groups with lower social standing, like prisoners, they've been selected as study participants, which really does raise some ethical concerns. And ethical concerns arise when vulnerable groups are chosen specifically for research studies. And there has been discrimination in research. During the 90s, women and minorities were found to be excluded from many clinical studies. And one that comes to mind is like, especially with women and heart disease, they don't have much studies on that. Women have different signs and symptoms of a heart attack versus men. Regulations in the United States now require researchers seeking funding from the National Institutes of Health to include women and minorities as study participants. And that National Institute of Health has been abbreviated to NINR. And there are some obligations for fair treatment. Researchers must treat people who decline to participate in a study in a non-prejudicial manner. Researchers are obligated to honor all agreements made with participants and show respect for the beliefs of individuals from diverse backgrounds. Another very important aspect to the ethical principle of justice is the right to privacy. Intrusions in privacy maintenance is when research with humans involves intrusion into their lives. Researchers should ensure that their research is minimally intrusive and that participant privacy is maintained. And confidentiality and HIPAA has really provided that, or should anyway. Participants have the right to expect that any data they provide will be kept confidential. And the Health Insurance Portability and Accountability Act of 1996, HIPAA, sets federal standards to protect patients' medical records and health information. And you just keep in mind that it's constantly being updated, especially for healthcare providers who transmit health information electronically. We are in that day and age where everything is online. And so there are some new rules that have been updated since 2003 for the standards of keeping and maintaining that privacy. There are procedures that researchers must do to protect these participants. The one of them, very first one, is the risk and benefit assessment that they must conduct. They must get informed consent. There is confidentiality procedures. This includes anonymity, getting confidentiality in the absence of anonymity. Then they can do debriefing and referrals. There's external reviews and the protection of human rights. And then ethical issues in using animals in research. And the following slides, I'm going to go ahead and go over each one of these. In a risk-benefit assessment, potential benefits of the study to individual participants and to society are weighed against costs to the individuals. And here off to the right, I just kind of break it down a little bit. Again, like I said, the researchers conduct those. They evaluate if the benefits of participants in the study are going to outweigh the cost. The risk-benefit ratio is assessed to ensure it is acceptable, considering the major cost and benefits of the research participation. Benefits to society and nursing are also considered, with the selection of a significant topic being crucial for ethical research. The book also talks about minimal risk, which is a level of risk no greater than that encountered in daily life, while non-minimal risks require caution to minimize and maximize the benefits. And then you have the evaluation of the risk-benefit ratio. That can involve considering how comfortable one would have, felt as that study participant. Box 4.1 here is directly from our textbook. I took a screenshot of it. It's on page 66, and it's the potential benefits and risk of research to participants. And the major potential benefits to participant, you have it broken down here. It's the access to potentially beneficial intervention that might otherwise be unavailable. You hear that all the time where, someone who gets a diagnosis and they don't care and they're like, sign me up for something, I'll, test on me. And another benefit is relief in being able to discuss their situation or problem with a friendly, objective person. That can be very therapeutic. And think about the qualitative, studies that are conducted as well, where we're getting that perspective, that knowledge. And then that leads me to increased knowledge about themselves or their conditions, Another benefit is just having an escape from their normal routine. And then can also be a satisfaction that information they provide may help others with similar problems. And that's not uncommon. People want to relate to each other. Direct gains through stipends and other incentives. So remember that there's a very fine line with coercion and getting stipends, especially if it's a vulnerable group of participants. We got to be cautious because we don't want to skew that or coerce them into doing something that they don't want to do. So we really got to be careful with that last one. Now, major potential risk to participants. So these are things we need to weigh now versus the benefits. So the physical harm that's going to come about. This includes those unanticipated side effects if we're testing out medication or certain interventions. And this includes physical discomfort, fatigue, and they even include boredom. Emotional distress from self-disclosure. That's understandable. Discomfort with strangers. Embarrassment relating to questions being asked. So this is where our nursing skills come in. This is where we have to, bridge that gap and be empathetic and, use very much active listening. Another risk is social risks, such as that stigma, negative effects on personal relationships. There's a loss of privacy, loss of time, and then monetary costs. Do they have to drive a far away? Do they have to get extra child care for this? Loss from work. So this is the assessment that has to be done before conducting the research for these participants. So we have to weigh these against each other. And there are potential benefits and risk of research to participants. So this is kind of reiterating this again. Major benefits include access to beneficial interventions, relief from discussing issues, increased self-knowledge, escape from routine, satisfaction of helping others, and direct gains. And remember, with that direct gains, we have to be careful with coercion. Major risk encompass physical harm, discomfort, emotional distress, social risk, loss of privacy, time, and monetary cost. Physical harm may include unanticipated side effects, while emotional distress can arise from self-disclosure or discomfort with strangers. And then social risk, that involves that stigma and negative impacts on personal relationships, while loss of privacy, time, and monetary costs are also significant risk. So this just kind of sums up that chart, or that box 4.1. So moving on, informed consent is a huge thing. It involves participants having adequate information about the study. So that's where we come in. We have to provide them with everything. We can't leave out anything. And are they able to comprehend that? Do they understand what that means? And then they have to voluntarily consent, or they can have that opportunity to decline participation. And researchers document informed consent by having participants sign a form detailing the study purpose, expectations, voluntary nature of participation, and potential cost and benefits. Okay. And then how we obtain the informed consent. It's written. It's typically obtained through assigned consent forms, except in cases of self-administered questionnaires where implied consent is assumed. So that sounds like a gray area. And they'd kind of go over it with qualitative studies that involves designs or evolving designs. Consent may be an ongoing process known as process consent, because we see in qualitative studies how things change over time. It's evolving. It's not as strict as quantitative. And then you're continuously renegotiating as that study progresses. So the next step to ensure that we're protecting our participants is having confidentiality procedures. Anonymity for confidentiality. This ensures that the highest level of confidentiality is by preventing the researcher from linking participants to their data. So nothing can go back to that in any of their journals or articles. You can't, pinpoint that participant. Okay. So what happens when there is an absence of anonymity? When it's not feasible, researchers ensure confidentiality by promising not to publicly report identifiable information and taking steps like using ID numbers instead of their names. Confidentiality is crucial in qualitative studies due to their in-depth nature, where anonymity is rarely possible. And we need to have that trust, especially with qualitative studies, because we are trying to gain their perspective. We're trying to get that information from them. And if we can't ensure their confidentiality, do you think they're going to be forthcoming? No, they're not. So that's why it's really important that we protect them. And then we have some challenges and legal aspects of confidentiality. I wanted to include this. With challenges, there are solutions as well in confidentiality. Qualitative researchers face challenges in disguising participants in reports due to small sample sizes and the rich descriptive data, and that makes sense. So, to enhance privacy, researchers often avoid disclosing specific study locales. Now, the legal aspects and confidentiality. Confidentiality can lead to tension with legal authorities, especially in cases involving criminal activities like substance abuse. And that's understandable. Researchers in the U.S. can apply for a certificate of confidentiality from the NIH. And the NIH, that's just the National Institute of Health. It's to protect participant information from forced disclosure in legal proceedings. Basically, what that's saying is that certificate, it allows researchers to refuse to disclose information on study participants in any legal proceeding so they can protect them, okay? Debriefings and referrals in research is another way to protect participants. And it's really just having respectful interactions. Researchers should demonstrate respect for participants by being polite and tolerant of cultural, linguistic, and lifestyle diversity. There are formal strategy for communicating, for the communication of respect, such as offering debriefing sessions after the data has been collected, or even asking them if they have any questions or concerns. I mean, this is really advisable for these participants so they can express their concerns. And then sharing study findings with participants after the analysis, and then you can make referrals to appropriate services when needed, are another way to show interest and support. And just to extend with respect to them, there are ethical considerations for vulnerable populations. Now, adherence to ethical standards is often straightforward, but special vulnerable groups may need extra protection. And here are some groups that we consider to be vulnerable. Children. They lack the competence to give informed consent, and it requires their parent or guardian to do that for them. And they usually call that assent. Now, assent from the child may also be appropriate, especially if the child is at least 7 years old. So you kind of have to get them to go along with that. It's the affirmative agreement from the child to participate. Mentally or emotionally disabled people. These individuals are unable to make an informed decision, and you can even say people that are in a coma, they can't make these decisions. Anything to necessitate consent from a legal guardian, that's where we have to get that from, and they are vulnerable. Severely ill or physically disabled people. So you have patients that could be going under treatments that really do affect their decision-making abilities. And so they need their capacity to be assessed to see if they're able to participate in these studies. The terminally ill. Due to the limited personal benefit from the research, a careful risk-benefit assessment is crucial. Institutionalized people. Emphasizing the voluntary nature of participation is essential for these groups, especially, given the past record, how experimentation was done on people in asylums. Very unethical, and so they still carry that stigma with them. Okay, so we really got to be careful because they are still vulnerable. Pregnant women. Additional U.S. government requirements are aimed to safeguard both the pregnant women and their fetuses. And they have to be able to consider the heightened risk involved for both. Okay? And they say that just because of, they consider the fetus, they can't give consent. External reviews and the protection of human rights. So why is external reviews important? Well, some researchers may not be objective in developing procedures to protect participants' rights. And that can be due to biases from their commitment to a specific area of knowledge, or it can be that desire to conduct a rigorous study. Ethical dimensions of a study are usually subjected to external review to mitigate biased self evaluation. And there is an institutional review board, or the IRBs, and most hospitals and universities, research institutions have formal committees for reviewing research plans, such as human subjects committees, research ethics and boards, that's in Canada, and then the IRB is in the United States. Researchers must submit research plans to the IRB before undertaking a study and undergo formal IRB training. IRBs can improve proposed plans, require modification, or they can disapprove them if they say they consider it not to be ethical. Now we move on to ethical issues in using animals in research. Nurse researchers focusing on biophysiological phenomena may use animals as subjects, with ethical considerations differing from those for human participants. In the U.S., the Public Health Services has issued guidelines on humane care and the use of animals in research, covering aspects like the transport, pain management, anesthesia, and even euthanasia for them. This is a summation of this chapter. So just looking at guidelines for critically appraising the ethical aspects of a study, we need to know the importance of ethical guidelines. Research articles may not always include detailed information about ethics due to space constraints in journals, but acknowledgement of study procedures being reviewed by an IRB or human subjects committee is common. Formal review by concerned individuals indicates thorough consideration of ethical issues in a study. Evaluation of researchers' adherence to ethical guidelines can be challenging. Consideration of ethical aspects is crucial for maintaining research integrity. Evaluation based on study methods. There's assessment of whether study participants were subjected to harm or discomfort. Identification of situations where informed consent may not have been properly attained. We need to evaluate the consideration of voluntary nature of participation in the study. And then we need to look at the analysis of the description of study methods to infer ethical considerations, and judging whether the benefits to participants outweigh any potential risk or discomfort. And this is just consideration of study participants. The importance of providing more protective procedures for vulnerable groups involved in the study. Recognition of the mission of certain groups, such as minorities, from clinical research. The need for additional information when vulnerable groups are part of the research. Attention to ethical implications of the study participants' characteristics, and ensuring that all participants are fully informed and aware of the research purpose. And this comes directly from our textbook, page 70, box 4.2, Guidelines for Critically Appraising the Ethical Aspects of the Study. And we need to ask these questions. Was the study approved and monitored by an institutional review board, research ethics board, or a similar ethics review committee? Were study participants subjected to any physical harm, discomfort, or psychological distress? Did the researchers take appropriate steps to remove or prevent harm? Did the benefits to participants outweigh any potential risk or actual discomfort that they experienced during it? So always think of beneficence. Did the benefits to society outweigh the cost to the participants? Was any type of coercion or undue influences used to recruit participants? Did they have the right to refuse to participate or withdraw without penalty? Were participants deceived in any way, Were they fully aware of participating in a study? And did they understand the purpose and nature of the research? Were appropriate informed consent procedures used with the participants? If not, was there a justifiable rationale? Were adequate steps taken to safeguard participants' privacy? How was confidentiality maintained? And was a certificate of confidentiality obtained? And if not, should one have been obtained? Were vulnerable groups involved in the research? If yes, were special precautions instituted because of their vulnerable status? And were groups omitted from the inquiry without a justifiable rationale, such as women or men or even minorities? Okay. And this is just my reference page.